Hi, this is Jerry Hesch, and I'm presenting a couple of exercises for a client with spinal stenosis. We tend to lose ankle range of motion over the course of our life, and it shifts our weight somewhat forward. And I'm going to teach you several ways of gaining ankle range of motion. The first thing I'm going to show you right now is how to glide the talar bone posteriorly. And what you do is you take a piece of leather, a belt is fine. If you have access to a 1/2 inch width, no more than 3/4, that is ideal. And what you do is you plant your foot on a table or on the arm of the sofa, and you take that strap and you let it slide up the foot until it hits the ankle. And you put a mild amount of weight onto that foot, okay? And you pull straight back with that strap. And you use a kitchen timer and you set the timer for 2 minutes. And I recommend that initially you do this exercise once a day and you repeat it daily for a week. And after that it should maintain rather readily, so you can then do it twice a week. The second part of this is to take that strap a 1/2 inch superiorly to grab the lower part of the tibia bone, and you just very gently pull back, set your timer for 2 minutes, and the same thing daily for a week, and then twice a week thereafter. And later on I will show you a wonderful stretch for the heel cord and the foot and the plantar fascia. I'm going to switch gears here and show you a way of stretching the rotators of the hip, particularly the piriformis, which can tighten over the sciatic notch, over the sciatic nerve, in the region of the sciatic notch for some clients. And many of us present with tightness in the hip rotators, and particularly on the right hip. And I blame driving the car and using the gas and letting the right hip fall outward. So the technique for stretching the hip rotators, and you might want to first test to see if there's a difference. So you lie on your back, and I'm going to first test rotation. So I'm pointing my right foot inward and stretching all the way up to the hip as far as it goes. I'm going to do the same thing on the right and stretch that in as far as it goes. To stretch the hip rotators on the right, if they're tighter, you take this piece of foam, either 2 or 3 inch tall, and you place it vertically, and you place it under the hip so that the outside of your front pocket is at the middle of the foam. So you roll over a little bit and place it underneath it, and I can feel that piece of foam just slightly indented when I touch the outside of my hip and pelvis. And you just lie on that for 5 minutes, and it's very effective in releasing those muscles. And you can certainly treat both sides at the same time. When you're finished, you want to then focus on stretching the hip rotator musculature and gapping your hip joints. We tend to lose hip extension primarily on the right side, but some people lose it on both sides or have it reduced. And a very effective way of improving that is to take the foam and you then place it horizontally, and you place it on the thigh just below the sit bone, and the leg is out straight. And I recommend treating both sides at the same time, and you lay on that for 2 minutes, and it can be very, very effective. After that, you get up and walk around and see how you feel, and you may feel like your whole body is lighter, and it can be very helpful for low back pain. So that's the way that we address hip rotation, hip extension and hip rotation. There's many ways of doing such, but those are very simple, straightforward ways of doing such. The next thing I want to show is a couple of ways of stretching the low back. And what you do is you take a pillow or two and you place them under your pelvis or your bum. So I'm going to put these two pillows under my pelvis, okay, and no higher than the belt line, and then I'm going to bring both of my knees up towards my chest, and I'm going to hug them. And you consistently maintain a very gentle stretch, and I'm going to put my other leg out straight. Okay? So I'm stretching one leg at a time. I'm bringing the right knee straight up towards my chest for 2 minutes while the other leg is out straight. And you can do this for 2 minutes. You can certainly do it for longer. And I recommend it once a day for a week and twice a week thereafter. So then you switch, hug the opposite leg, put the right leg out straight, and bring the knee up progressively up towards your chest. When you're finished doing this, I want you to then take both knees and I want you to give them tiny little stretches, little tiny oscillations 30 times. So we're trying to open up the space around those nerve roots, increase the space in the neural foramina where the nerve roots come out of the spine and come out to form the sciatic nerve. So we're trying to increase some mobility there. So after doing 30 of those, then what I want you to do is put the left leg down flat. So the foot is flat, the knee is bent. Take the right knee, stretch it towards the outside of your right shoulder. So it's out to the side about 30 degrees, and you set your timer for 2 minutes. Stretch it very, very gently. And this is to rotate the pelvis backwards in relationship to the spine. After 2 minutes, you switch. I'm now taking my left knee towards the outside of my left shoulder, and you do this for 2 minutes. I want you to do it once a day for a week, and then you can do it twice a week after that. Now I want to show you a way that you can do traction to the lumbar spine using your body weight. So you do this on your bed, and you stack several pillows down to the lower part. So this is the side of my bed. So I'm going to arbitrarily use 3 pillows. And I'm going to lay over this. You want to check and see if the camera angle is good. So my stomach will go on the pillow. My waist will be below that. So I just walk into it, and it places my lumbar spine in flexion, and I let my legs hang off the edge of the bed. My toes are almost touching the floor. And place your head in a comfortable position, either resting on your forehead or you can turn it to one side. And set your timer for 5 minutes. I do want to warn that if any of these things produce numbness or tingling or discomfort in the legs or the feet, you do want to stop. So we don't want to provoke any lower extremity symptoms. Hopefully you'll perceive a very gentle stretch throughout the legs and low back, and hopefully it'll have a very positive impact on your symptoms. Another way of doing this, you can also touch down with the front of your feet and stretch your heel cord and hamstrings at the same time. So if you could get an image of my feet. Okay, we are going to switch gears now and talk about the importance of keeping free mobility in your upper back and also in your neck. You can take the foam and you can place it below your neck in the thoracic spine, several locations. And so you place that horizontally and you lay on it, and most of us need to restore arching of our upper back. And so you want to try this between your shoulder blades all the way up to your neck. Now, you can do whatever you want with your arms. It might help the stretch, it might not. So your arms should just do whatever comes naturally. And allow your neck and your head to glide straight back. Okay? Now when you get further up, just below the neck, it's helpful for some to place the foam right up close to the edge of the bed, such that your head comes off the edge if you need a little extra room to allow your head to glide towards the floor. So there's several positions where you can place this foam horizontally. And the uppermost position just below the neck, you might find it helpful to have your head off the edge of the bed and let your head glide straight back towards the floor. There's a wonderful research article published last year, and it showed that people who added posterior gliding of their neck benefited in reduction of sciatica over those who just focused on low back exercises. So the addition of exercise with posterior glide of your neck can be very helpful. So when I do this stretch, I do it for 2 minutes and I just relax into it, let the weight of my head do the stretching. So I do this for a minimum of 2 minutes. After that, I actively glide it backwards. It's a subtle movement. There's not a whole lot of range available, and I'm trying to exaggerate it a little bit. So you can add 30 reps of pure posterior glide exercise. You can also place the foam vertically between your shoulder blades, and that might have a different type of effect. And there seems to be a mid position, and then you can scoot down, and there is an upper position that can be helpful. Then if we take the other piece of foam and we put them side by side, you can lay on that for a while, and then you can separate them a little bit further and get more of the rib cage to close in the back, open up the chest wall. And so let me get another piece of foam. And so you place them first next to each other like that. And the primary location is between the shoulder blades, like this. And depending on your body size, you might also value having them separated out a little bit further and get more of the ribs. So I'll create a little bit of space between these. So I certainly appreciate the pathology of lumbar stenosis. It was my diagnosis. I had symptomatic spinal stenosis and had it treated surgically. And I find that doing these exercises is very helpful when I start to get symptomatic, and I also do them on a preventive basis. And I believe that by treating the whole body, we're going to be a lot more effective in managing it than if we just focused, for example, on low back exercises. So let me look at my list and make sure I'm not missing anything. Okay, so we will stop filming now, and then we'll come back and film part 2.